IR has produced procedures over the years to treat the most common complications of portal hypertension, has actually played a pivotal role in the management of these patients. TIPS, which is transjugular intrahepatic portosystemic shunt, was introduced back in the late 60s at an experimental level and then established to a clinical level some years later, and has saved the life of these patients. In essence, what we would like to do with TIPS, as we all interventionalists know, is to reduce the gradient that is present between the hepatic veins and the portal vein. But this is not the only procedure that IR can offer for these patients. We have a number of procedures from portal vein stenting, if we're dealing with a condition that has a prehepatic hypertension factor, like the occlusion of the portal vein, but also the embolization of the varices that can be accompanied by TIPS or on its own. And this is the well known as BRTO procedure, or the balloon occluded retrograde transvenous obliteration procedure. So there's a number of procedures that IR has developed over the years and can help the patients with portal hypertension. There's a number of guidelines that have been issued, not very many over the years. We have guidelines from CIRSE that were produced in 2012. We had some guidelines from SIR that were produced a few years later. What is interesting, and this is included in the package, is the fact that we also included the latest guidelines of the British Society of Gastroenterology that are enhanced also by the British Society of Interventional Radiology. And these offer an extensive overview of what is currently available in terms of evidence, but in terms of patient approach, in terms of recommendation, and in terms of level of evidence. So we have all that, and this document is truly an extensive document. I would recommend for anyone to read that. It's not a purely IR-driven document, but it's definitely interesting, and this would definitely enhance the knowledge of this area. So I would go for these guidelines first. So the evidence that supports the whole range of procedures that are involved in portal hypertension is a bit mixed. So we have low-level evidence for procedures that are established, but also we have some high-level evidence. In essence, we have a high recommendation from expert panels, but also high-level evidence for the use of cover stents for TIPS, for example. But also we have to accept the fact that there's a number of patients that cannot won't benefit from TIPS, and this is also coming at a higher recommendation from the guidelines with a medium level of evidence. The embolization of varices also comes as a strong recommendation, but with a medium level of evidence. So that we have a variety of levels of evidence, depends on whether we have RCTs that justify a specific treatment, but we have also strong recommendation from expert panels for specific management of these complex patients.